We will start now. We'll start our session in a few seconds, yeah? So just get ready. Okay. Assalamualaikum and good afternoon. Welcome to MASISWA Sports Excellence Webinar 2020. This is the first session that we are doing for MASISWA for this year. They say that we can't touch each other during the COVID at the moment, but I think we have to do all these kind of virtual touching on each other to show that we care and we support each other, as the message that no human is limited now in everybody's mind. It's very clear. My name is Ali Kadir and I am the moderator for today. Before we proceed, once again, can I request all the participants to mute your microphone and off your video? Yeah? Okay. So our session today, the Sports Excellence Motivation program, is meant to address the mental and the physical health implemented in preparation to athletes in IPTS to face COVID or post-COVID challenges. The program is first to be held is that of Majlis SUKAN IPTS, MASISWA, also known as Sports Council of Private Institution. With this program, we hope athletes can make initial preparation with the effective individual management technique and methods. In addition, we hope that this program can help prepare athletes towards facing the training session and tournaments. And we hope that towards the end of the session, you will be guided on the psychological and physical challenge to achieve excellence, and we hope that you will know the importance of planning in this new norm for the athletes as well. We will have our question and answer session after each talk, so please share your questions on the chat box with each speaker respectively. Just leave your name and your IPTS, then we will just address the questions that we think, if time allows, for as many as we can. There are plenty of questions, I'm sure. For instance, we don't know what is the best exercise during COVID. We just don't know whether can we use the surgical mask and exercise, is it necessary? Has this exercise or physical activity has any effect or immunity to the COVID-19? What are the best ways to conduct the online exercises, and how the depression, how mental health is been affected by all these activities as well. So yes, there's a lot of discussion that we can have today. So we hope that we can have some interesting questions from you. So before we proceed with the speakers today, may I please invite Mr. Tan Seng Seng, the Intellectual Development Committee of MASISWA, to say a few words. Mr. Tan Seng Seng.
Thank you, Ali, our moderator. Ali, also my friends is MASISWA. Thank you for giving me the opportunity to say a few words to introduce. I will take this opportunity to introduce about MASISWA and what are the programs that MASISWA will be showing. Can I have the slide, please? Yeah. Okay, so I will my presentation will be on two parts on the introduction of MASISWA. Okay, what is MASISWA? Can we next slide, please? Yeah. Okay, what is the role of MASISWA? As you all know that MASISWA was set up one of the objectives is to encourage activities, to promote activities in sports among the private university students. And then the setup of MASISWA also in line with the National Sport Policy in 1988 that we want to encourage all the university to be active in sports. And MASISWA also that we are same like some other sports body. If you can see under the umbrella of Ministry of Higher Education, we have this MASOM, MSP, and MASCOM. MASOM stands for Majlis SUKAN University Umum, I mean public university. and then Majlis Sukan Polytechnic and Majlis Sukan College Community. So here with us, MASISWA, we are also part of the Majlis, the 4 Majlis under the umbrella of Ministry of Higher Education. With MASISWA, we have about a total of 497 institutions of higher learning under the umbrella of MASISWA. So you can see our role is huge for us to promote sports among the university students. Okay, after as you know that in Malaysia, the government of Malaysia announced the movement control order since 18 March 2020, which was the first ever that all of us are required to stay at home. When this one was announced, and then university are required to close, and the students have to learn from home. So these are something that we can see happening in early of the March. And then with the effect of this COVID, all industry are facing crisis during this MCO as business are being limited. This also directly affect the sport industry, especially in sport industry. You can see gym, badminton center, futsal court, sport facilities are being ordered to close down. Major sports event like international event, for example, we also know that the Tokyo Olympic in Malaysia, those related to us are SUKMA, SUKIP. All these events has to be postponed or postponed. Okay, Majlis Sukan IPTS also has many planned early this year. We also have to cancel some of our event. During the MCO, athletes are losing their motivation due to being locked down at home. Without meticulous guidance from coaches, proper equipment for training, and most important, supportive friends or teammates, the talent pool shrink as more and more players drop off from the sports. With no championship sports event ahead in sight, players tend to lose focus on their training, retiring from sport, losing interest, losing source of income. So this is what happening from during March until now. In this period of difficulty, we Majlis Sukan IPTS wish to do a small part helping the sports community among private university. This brings us today the webinar series Sports Excellence Motivation. So this series of talk is to provide the key to help open the lock that has been chaining us down, to answer the question by athletes on how to maintain the intrinsic motivation to continue work hard and find the purpose of training. So as you say, this is also a new norm for us student and athlete now. We hope this talk will be beneficial to all athletes as we are in the same field. We understand the need of your challenges you are facing. Okay, so the other part also I would like to also showcase or introduce what are the events prepared ahead for us next year. Can we have the next slide, please? Okay, for the calendar of MASISWA 2020, we can see that we have 4 main events that have been lined up for next year in 2021. We have this KEJOHANAN Sukan MASISWA, KEJOHANAN Sukan UTAMA program. We have this program development program, and then the international sports meets. Okay, next. Okay, next slide, please. Okay, for KEJOHANAN Sukan MASISWA zone, for your information, we have this 6 zone. We have Zone Selatan, Zone Utara, Zone Tengah, Zone Sabah, Zone Timur, and Zone Sarawak. So these are the very well received sports. During the zone tournament, we have a series of sports, compulsory sports, at least 5 or 6 sports will be compete among the IPT. So this we will divide the IPT according to their zone. So I hope that you all can follow up with us in the next coming event. Okay, next. Okay, so and the other in our calendar also is, we can see, is KEJOHANAN Sukan Utama MASISWA. Okay, here we have a series more than 10 activities, 10 sports for 2021. Some of the popular sports, you can see that we have this KEJOHANAN Bola Keranjang 3x3, We also have football. All sport. This is an individual sport. This sport is open to individual IPTS. Each university, you can represent your university to take part in this event. So we have a series of sports lying ahead for everybody. Okay, next. And for development program Pembangunan, so we have 4 events for next year. One of the event will be a Kursus Pegawai Teknik Berenang. So this event is not only open for officials from the university, we also open for students. If let's say you are a first year or second year student, you are very keen to be one of the technical officer, you can sign up for these courses. Once you are qualified, you can be official in the upcoming tournament organized by, because this is all our national level peringkat kebangsaan. So once you are qualified, you can be official for this swimming tournament. We also are going to organize seminar clinic for basketball 3x3 and 5-on-5, and we also going to organize a kursus petang. Peringkat 1 is will be held in Sabah. And we also propose to have the sports massage to be organized in Zone Sarawak. So we hope that all of us students can join this program Pembangunan. Okay, next. And for your information also, a big number of students from IPT representing IPTS are representing Malaysia for this tournament. So for next year, we have 3 major tournament, international tournament. One of them is we have the 6th Asian 3x3 basketball will be held in Taipei. And then in the month of June, 17 to 28 June, we have ASEAN University Game. For ASEAN University Game, will be held in Ubon Ratchathani, Thailand. So we also have Malaysia also will send a big contingent for this tournament. And finally, on August 18 to 29, we have this World University Game, or we call it a Universite Game. Okay, next. Okay, in MASISWA also we want to advise athletes those when you are. We also know that some of the athletes have been very stressful, staying at home. So now we are going to start their own training. So my advice to athletes that we need to be extra careful with this virus, as contacting this viral will cause danger to all others around us. We might not be the victim, but we put those vulnerable groups such as children and the elderly with weakened immunity in great danger. Okay, what we can do is to follow the SOP issued by respective ministry and help cut the chain of infection. Let us show our support to the authority by following the 3C or 3W. Promote by Ministry of Health. Avoid 3C, avoid crowded place, confined place, and close conversation. And maintain 3W. Wash your hand with soap regularly, wear masks and at all time and in public. So we are frontliner. Okay, next. We also want the student to follow us, like us in social media. We have this Instagram and Facebook. So all our activities for upcoming year 2021 will be published in this social media. So from time to time, do view do follow us so that we can upload our activity in this social media. Okay. Yeah, I think that's all from myself, from MASISWA. Once again, I would like to thank you, everyone, for taking part in this first webinar. Thank you.
Thank you, Mr. Tan Sen Seng. We believe that this is one of the toughest year for the Sports Council like MASISWA because of the challenges that we are having now. But despite having this challenge, I think MASISWA is doing a great job. I think MASISWA is one of the active sports council that consistently doing all these events. We have seen the list of the events that have been done. And I think there's so many opportunities for the IPTF students to participate for the event, like big, huge events next year. from the local to the international to the world level. So thank you very much, MASISWA and Mr. Tan Seng Seng. And good luck for all the athletes to participate in that. Okay, now we have seen all the plans of MASISWA, the tournaments and everything. So how are we going to prepare ourselves mentally and physically? So without further ado, may I please invite Dr. Ao Yong Pui-san, sports and exercise medicine physician working with the Ministry of Health. She is also an alumni of IMU as well, and she'll be speaking on exercising and sports. What's the new norm? Dr. Ao Yong Pui-san, the stage is all yours.
Thank you. Hang on, let me just share my screen. All right, you can see this, right? Can you all see this? Okay. Hi, my name is Dr. Pui-san. I'm a sports medicine and exercise physician. I currently work with the Ministry of Health, and I am based in Hospital Seremban, the main GH. Now I'm going to talk about exercise and sports in the era of COVID-19. What is supposedly our new norm? Okay. Next. Hang on, how come I can't share this? All right, so this is my hospital, the main GH in Seremban. What we have in our hospital is we have a sports medicine rehab gym, about 5 minutes away from our main clinic. What we usually do there is we get our patients who are post-orthopedic trauma, post-sports injury, post-ACL recon, ligamentous recon, post-surgery to do rehab, to get them back to sport. We also do a return to sports program. So that is the only thing special about our hospital compared to other Ministry of Health hospitals. But eventually, we aim to have a lot of our Ministry of Health hospitals to have a gym as well. So hopefully that will happen. Why can't I change this? Hang on. I think I need help. I can't seem to be changing the screen. Ali, I may need help. I don't know. It's just stuck though. Perhaps you guys may want to share instead.
Okay.
Yeah. Yeah, I think you guys share instead. Okay. All right. I'm sorry for that technical error. I'm not very good at IT either. Okay. I have a disclaimer. Initially, when I was approached by IMD to present this, our MTO was easing. The COVID cases were more or less under control. Our country was opening up, and things were getting a lot better in terms of, we were just going back to near normal of as normal as we can get. So what I initially wanted to present was how to return to sport safely and not get injured. However, for the past 1 to 2 weeks, with our numbers rising, I've decided to change my slides completely. So what we're going to talk about is safety, and I think that is more important right now in case MCO restarts again. Next one. Can we change slides in here again? So what we will discuss today, following slide. Okay. What I need you to know is at this point in time, what we know and what we do not know about COVID-19. There are a lot of things that we know compared to what back in March 2020, but there's still a lot about this virus that we do not know. Regarding that, we'll discuss why the government and the Ministry of Health keep talking about social distancing, how to do social distancing in exercise and sports, which is quite difficult. And whether or not you need to wear a mask while exercising, I think there was a bit of hoo-ha about this. And there was a bit of news going around saying that some kids in China collapsed while running wearing a mask and stuff like that. And then what we should care about why we should care about the rising numbers of COVID in our country. On this slide. Okay, so a lot of questions people will ask is, I don't want to exercise outside, but I don't know if it's safe. So let's talk about what is the new norm. Continue. Okay. What we know about COVID is it spreads via respiratory droplets, which means when you talk, when you cough, when you sneeze, we actually produce small, very tiny, naked to the eye, droplets of fluid. And inside this fluid, if you are infected, that's where the virus resides. So this droplet can be big or can be very, very tiny. So if it's a big one, it'll just fall right in front, which is why people always say, oh, don't touch this table, or don't touch a chair, or don't touch anything between your hands, because the virus survives in the droplets, and the virus is still surviving on the surface that the droplets fell on. However, I'm also sure you guys have read about the virus being airborne. Now, if the droplet itself is very, very small, they can stay suspended in the air for quite a while. So that is the airborne part of it. So if you're close enough in personal contact with someone that is infected, your risk is generally a lot higher. So infection period, right, is the time that the infected person with the COVID-19 virus spread around. It's about 1 to 3 days before they start having symptoms. Problem is they look and feel almost healthy before the symptoms start. So you are probably hanging around with them for a very long time, or you're very close contact, and then they fell sick and you're like, oh, darn, and you have to get yourself tested, right? So once you have the symptoms, it will last until 7 days of infectivity. So it's quite long. Following slide. As you know, there's no vaccine available right now, and the best way and the safest way to not get this virus is actually distance yourself from other people. It's easier said than done. Okay? The second best way is actually to wear a mask, but you have to wear the mask properly, which means your nose must be covered, and there is no extra space in between the mask and your face. So I work in a general hospital, and I see. Actually, I've never stopped working. I've never worked from home, unfortunately. And I see patients day in, day out, and 90% of people don't wear the mask properly, which defeats the purpose of actually wearing a mask. Okay? Which is why we add on to the mask by having a lot of hand hygiene, and try your best not to touch your face, your eyes, your nose, your mouth after touching other surface without washing your hands. Following slide. So people always wonder, is it dangerous, right? Because compared to some countries, they basically initially in Wuhan or even America, we don't have a lot of deaths, and most of them walk around looking quite normal. Following slide. So this is where what we do not know come into place. We don't know much about this virus. It is new. We don't have long-term data, which means that if you're infected, if you recover from it, 6 months down the line, 1 year down the line, maybe 5 years down the line, will you have complications? That part we do not know. Compared to other things like the flu, which has been coming in and out every single year for the past God knows how long. So this is where we need data. How about why some populations get very severe respiratory symptoms and require intubation? We don't know that either. We can speculate and say maybe it's the weather, maybe it's the diet, maybe it's the community. We really don't know. So maybe it's a different strain, maybe the virus has mutated, all this is just speculation. So will it or will it not mutate into a more lethal strain? a possibility, that's what I can say. Because the more times the virus gets infected and passed along to more and more people, the higher chance of it being mutated is going to be there. Okay. Also, there's a new thing now that what we call long haul or long COVID, okay, where people got the virus, they got better from the virus, and after that they start developing symptoms. We'll talk more about that in the later slide. Continue. You need to change the slide now. Oh, there you go. Okay, so can we go back one slide? I think I missed one. Okay, so you can be having the virus, you can be passing around the virus, but you still can be asymptomatic, which means you don't even know that you have the virus. And the best case scenario is you get the virus, you don't have symptoms, you get better from having the virus, life moves on, everyone's happy, no one dies.
Pass on to someone close to you, or someone, hello? Okay, or someone close to you, or someone who, say your mom and dad, and they fall ill, and then they die. So that is the worst case scenario. Continue. So now let's get back to exercise and sports. Next slide. Okay. In general, the safe consideration is outdoors, good ventilation. I know the government has already stated that outdoor activities less than 10 people is safe. However, we have no scientific data that says 10 is the magic number. Sometimes 10 could be one person too much, so we really don't know. But the smaller the group that you hang out with, or the smaller the group you're exercising with, the more open space the place is, the more ventilation the place is, the better it is for you. Continue. So what is not very safe is everything that's opposite of what we just said just now, which is confined spaces, poor ventilation, crowded, very near close contact. So this includes places like the gym, all your futsal courts, your basketball courts, your badminton courts, indoor buildings, stuff like that. Those are not considered very safe because we do not know the people that you're working out with, are they asymptomatic carriers of the virus or not? Okay, contact sports is also not considered safe because there is obviously no social distancing, right? Next slide. Okay, so why some people say, oh, contact a little bit only, after that, okay, you do it. But there are papers done in from Hong Kong that show that they actually review quite a few video footages of people playing football, and they actually say that a lot of times they actually come to very close contact with other people. So the average is actually 19.3 minutes for a 90-minute football game, but it ranges all between 5.9 minutes all the way to 35.5 minutes. Now, 35.5 minutes of very close contact is a very long time. Okay, so if you had no virus, I'm quite sure the chance of you getting the virus is very high. Okay, and then a lot of time when you're playing sports, what you do is you use your hand and wipe your face because the sweat, and also therefore you're touching your eyes, your nose, your mouth. So whatever virus is actually on your hands is going to get into your system. Next slide. Okay. Some people will tell me that can you still hear me? Okay. Now, some people say that, oh, but doctor, exercising will boost my immune system, right? So if I get the virus, I should be all right. Well, yes, that's true. Please, next slide. Okay. Now, exercising at a moderate intensity, moderate duration of time, which is like less than 300 minutes per week, It's good. It does boost your immune system. You are a lot healthier than people who don't do it. However, if you do prolonged physical exertion, intense activities, you actually reduce your immunity for the next 3 days. Okay, so if you're training for sports, you're not going to train for like half an hour, 45 minutes. You're going to train for a few hours. You're going to train at high intensity. You're going to be pushing all out because you want to perform, and this will actually tax your immune system and tax your physical being as well. So you're actually putting yourself into a situation that is not favorable for you. Okay, so we don't want you. I also tell my patients personally, if you're exercising, it's fine. I'm okay with it. I encourage you to, but don't push the intensity and don't push the duration. Next one. Oh, how about mask? This was a controversial issue to begin with. Next one. Okay. We need to be realistic. I have actually tried working out with a mask because I wanted to do a research on it, but it's not going to be comfortable. It's very, very, very uncomfortable. And because you're not really wearing it properly, 90% of people don't, it doesn't really serve its function. And when you work out, you're going to sweat and you will make your mask wet, and a wet mask is not as efficient in preventing the infection compared to a dry or a new mask. So if you can keep your distance and you can exercise outdoors, you don't have to wear the mask. Next slide. So these two papers were done prior to the COVID infection. They were just wondering how medical staff walking around the hospital wearing masks, how that the walking affects them while wearing the mask. So if you wear the mask, your heart rate will go up after walking, just leisure walking, and also your perceived rate of exertion or how difficult you feel the activity is will also increase. So maybe usually you find RPE of 2 or 3 while brisk walking, you're going to find it's going to go up to like 5 or 6. Next slide. Okay. However, if you insist on working out in a very small and confined space, say a gym, and the gym is packed, they don't follow SOP, or you live with family members that are high risk, or you're working out closely with someone who you think may have the virus, okay, or you yourself are high risk or are immunocompromised, please wear a mask. It's just to be better to stay on the safe side. Next one. Next one. Okay, how about distance? Because some people say, 1 meter is fine. Some people say 6 meters is necessary. Some people say you need more than 10. So what does science say? Next slide. Okay, WHO recommended 1.5 to 2 meters. That is the same recommendation that the ministry is following right now, and that's what we're telling a lot of our patients as well. But there are quite a few studies that disprove that 1.5 to 2 meters is adequate, but not to worry about it. Even the experts in the field are talking about it. Next slide. Okay, so you read the slide, it says that when you cough, when you sneeze, right, the droplets actually fall a lot further than 2 meters. It goes all the way to 6 to 8 meters, sometimes up to 10, depending on how hard or how hard you cough or sneeze. So do we say everyone has to stay 10 meters apart? Because Malaysia is not very big. KL is not very big either, and there's not much space to begin with. We're not in the middle of nowhere. So to stay that far away is actually very, very difficult in real life, even though theoretically or scientifically it's proven to be a lot safer, which goes back to the reason of why masks, proper wearing of masks is actually important. Next slide. Okay, now people tell me this all the time. Oh, I think in America and Italy, the cases are terrible, even in Europe, because of the weather that is cold, and then because we are hot, so therefore we are safer. Yes, to some degree you are right. The same paper actually does show that at about 0 to 5 degrees, the virus stay more intact in the droplets. Therefore, it's more virulent when it passes around. However, the virus also survives better in high humidity places, and Malaysia is quite humid lah. Next slide. Okay, so no matter how hot our country gets, the number does not lie. The number, this was taken from yesterday's, it's already 710. Few days back it was 835. Okay, I just want to inform you guys, during the peak of our first MCO, our numbers were actually lower than the number of Selangor itself, the whole entire country. So right now we have Selangor itself and Klang Valley itself exceeded the maximum number of infection back in our first MCO. So that tells you that no matter how hot Malaysia is, it's not going to protect you from the virus. Next slide. Okay, so I mentioned about long COVID just now. Next slide. Okay, I have personally know a few patients who was admitted for COVID infection. One particular person came back from London in about late March, just as the cases were rising, and she fell sick. Prior to falling sick, she's a very fit person. She exercises like most days of the week. Actually, he's also a national athlete. He went for SEA Games in the Philippines. He competed in pentathlon. So after the resolution of the infection, until now, she doesn't feel normal. She still feels tired. She still feels a bit difficulty breathing. She has a lot of anxiety. There's difficulty sleeping. Her heart rate sometimes goes off the roof. So when I tried looking into this topic, it turns out that there are a lot of people complaining the same thing. In fact, the most famous celebrity having this issue is actually, what's her name? Alyssa Milano. She also complains of the same thing. So now, problem is, in the medical field, no one knows why. No one can explain why they have all these symptoms. So all this so-called long-haul COVID survivors, right, they band together and they start exchanging symptoms like, oh, I have this, do you have that? Oh, I have that, do you have this? Right? So papers are starting to come up, and if you read what I put there, it says that commonly complained symptoms are brain fogginess. You find that you can't think, you're not as sharp as you used to be. You also find that you don't sleep as well as you used to be. You may find that you're tired in daytime, but at the nighttime you're wide awake. A lot of them also have what did I put there? Exercise intolerance. Yep, you don't tolerate exercise that well. Your effort tolerance reduced significantly. Maybe last time you were able to run 10 km in 1 hour, no problem, that was an easy one for you. Now, maybe trying to get to 5K in 40 minutes or even an hour of walking is difficult for you. So a lot of people are complaining that. Some people even complain of lost the sense of taste, lost the sense of smell. All this falls under the symptoms of long COVID. Okay, and beneath there in my table there, I wrote there some of the autonomic symptoms present in a lot of patients. Next slide. Okay, so because we don't have a lot of data on long COVID, people are not really collecting. It is coming up, but we don't have the numbers of papers that we need to come up with a good conclusion. So there's a lot of speculation. So these are the common speculations of why some people develop it and some people are scot-free. So sometimes they have a comorbidity, or meaning they have an underlying medical issue which they never found out. So when they had the infection, it flared up the underlying issue. Or sometimes it's also from the acute infection of the virus, you have residual bodily damage. Sometimes the virus was not fully 100% cleared from the body. There is still some, but it's not detectable on your test. So it's persistently replicating and your body is trying to fight it off. Therefore, it's long and it's drawn out. Also, sometimes after the body has cleared the virus, the immune reaction, the systemic reaction to the virus is still ongoing. So you have like a chronic, I would say a chronic low dose systemic inflammation. But most of the time, we just don't know. Next one. Okay. The good thing about COVID research is all these papers are free. You don't even need to be subscribed to any of this publishing house to actually get them. As long as you type in the word COVID-19, whatever paper comes out, it's all free access. So if you want to read more, please go ahead. All these are free. Next one. Okay, now, because I did mention a lot of people are asymptomatic, meaning they walk around looking normal, healthy, right? But they may have the infection, and the body may have cleared off the infection, and they think they have immunity. So they say, so maybe I got the infection already. Because that day my brother was sick, and then now he's okay. Maybe I'm immune. So do I still need to wear mask? Do I still need to take the precaution? Next one. Now, okay. To date, there are about 3 months worth of data from the time that patient got better from the COVID infection. Okay. Yes, there are some. There are a lot of them that have the immune. How do I say, the immune cells towards the virus itself. But remember, it's only 3 months worth of data. So will this immune cells continue staying put, or rather the antibodies in the body continue staying put past 3 months? We don't know. Next slide. Okay, those past 2 studies that I shown in the last slide were about 14 to 15 patients per study, very, very, very small. This paper done, if not mistaken, Hong Kong or China itself, looked into 175 patients the day they got discharged from the hospital. So they look at they took their blood, tested the antibodies, and see whether they have the immunity towards the COVID. So 30% out of the 175 patients have some immunity, but the amount of antibodies is actually very, very, very low, which means that if they do get another bout of infection, they may go through the same symptoms again. The scary part is about 10 patients, which is 0.06%, do not have any detectable amount of antibodies, which means they have no immunity. Now, I know 0.06% sounds very, very little, but remember, this is 175 patients only. Worldwide, to be fair, I don't know the number exactly, but worldwide, there are so many more patients than that. 0.06% of several 100,000 is a lot of patients that are walking around without immunity. What if the number is higher? Next slide. Okay, so like I said, we do not have enough data, and we do not have long enough duration post recovery from COVID data to say that immunity lasts past 3 months. I hope it does. We also know, we do not know how large a percentage of recovered patients do not produce enough antibodies or adequate immunity. Even if the immunity is lifelong, right, mutations can occur to this virus. Like I said, the more times this virus gets transmitted from one person to another person, the higher the chances that the virus can mutate. So we do not know the next virus, whether our body can still recognize it or not. The other thing is, we look at dengue as example. I'm sure you guys have heard of when you are inflicted with the dengue virus, you get sick, which is very, very shit. You get sick, and then you get better, and the second virus infection is actually a lot worse because of how. What if COVID is the same thing? What if your second bout of infection may actually worsen your immune system? What if that itself is the one that's going to kill off humanity as we know it? So again, I know that it's like doom and gloom and a lot of speculation, but there is too much information up. We don't have enough information regarding COVID that helps us make make the best decision. Still, prevention is now the thing. Next slide. Okay, so I know you have read also or you watch on YouTube on the news that some patients suffer COVID infection quite severely. They get admitted into the ICU, they get intubated. A lot of them like literally drop and die, right? Whereas some patients just get admitted to hospital Sungai Buloh, they sit around in the ward for 14 days or until the second test came up negative. So why do some people get such a severe reaction and some people don't? Next slide. Okay, now this one. I am not an immunologist. I am not a virologist either. I'm just someone who interprets the paper. So, certain people, upon dealing with a particular infection like COVID-19, they tend to have a very exaggerated immune response. Why some people have it, that one we really don't know. But some people's immune response overpower the body itself, and that is why they get admitted to the ICU, they get intubated, or they die. Some people's immune response is very mild, enough to clear the virus, but doesn't cause much damage or havoc on the body, which also goes back to why some people develop long haul COVID and some don't. Next slide. So, okay. So in this country, our patients that develop, who contracted the virus, a lot of them are not too severe, I would say. But why are we worried? Next slide. Now, this is where we talk about public health, and this is where we talk about our healthcare system. We know right now COVID is a worldwide pandemic. We don't know enough about COVID to say that it's not very dangerous, because there are some people who are suffering quite severely from it. As long as we don't know this and it's a worldwide pandemic, what will happen is a lot of government hospitals or Ministry of Health hospitals are going to divert all their resources to treat, manage, and try to isolate COVID cases. So this will mean that all other cases that are non-COVID related or non-emergencies will take a back seat. And this is what I mean. Please, next slide. Okay. Let's say your mom found a breast lump when she was showering. She makes a doctor's appointment and it was planned for a removal and a biopsy. Now, if numbers of COVID goes up, we may go back into MCO. Klang Valley is already having an CMCO, right? And your mom's hospital say, you know what, we cannot see you right now. All elective cases are closed, our OTs are closed, all our staff are being siphoned off to treat COVID and run the ED. Therefore, we need to postpone your surgery. Or let's say your dad recently diagnosed to have diabetes or hypertension. So usually when you're newly diagnosed, you actually go back and see a doctor quite frequently to adjust the dosage so that you don't get into any complications or side effects. Now, when this happens, a lot of clinics or even the smaller clinics around, they're going to see a lot more patients that are KIV COVID positive or PUIs. So they're going to tell you that, you know what, uncle, we're going to postpone we're going to delay seeing you or postpone seeing you until the situation is safe, because you know you have diabetes or you have hypertension, so you are also very high risk now. Okay, so they say okay, then they go home. Or let's say your sibling got involved in a motor vehicle accident, maybe they fractured a bone, went for surgery. Now they're under rehab or physio to learn to re-walk again and learn to use that particular limb again. Okay, but because of the COVID infection, physio is going to close down because there is no safe distance when you're at physio. So they are very, very close to you. So they're going to cancel your appointment or tell you to make appointment once MCO is over. Next slide. So what will happen is when MCO does ease, the last time it was about what, 3-4 months? Yeah, about 4 months before our OT reopen and our physio start taking patients again. So in that 4 months, your mom may have her stage 1 then cancer develop into a stage 3 or stage 4 cancer, which means it was potentially curable, and now she is just buying her time. Nothing probably can save her by then. Or your dad may have something salvageable, diabetes, hypertension one may be salvageable. 3 months down the line, maybe he had a stroke, maybe he had a heart attack, maybe it had gotten so bad that he needs a lot more medication, maybe the hypertension had killed his kidneys and now he needs dialysis. So things can get pretty bad pretty quickly. Or because of the delayed rehab and delayed physio, your sibling may have long-term issues of walking again, because rehab after trauma must be started early. Late rehab always comes up with poor outcome. Okay, so things as simple as this can cause a lot of implications for you and also for your loved ones. Next slide. So instead of saying, oh, I want to go out, I want to see my friends, you know, I want my life to return to normal, which by the way, there's no normal in the near future, okay? Or I want to go and play sports, you know, futsal is my life. I don't play badminton, I will die. I do have patients telling me all this. So what I recommend instead in these times of uncertainty. Next slide. Be adaptable. This is very important. I find that a lot of people during this time are very rigid and they are unable to adapt to this new normal, which is why there's a lot of resistance with wearing masks. There's a lot of resistance with social distancing. When I say being adaptable, meaning change the way you work out, change the way you train. If you need to train from home, train from home. If you need to do homework, do homework workouts. At one point, I had a few patients from the adolescent swim team from KL, and they'll come to see me because from swimming, they switch everything to home-based workout and all bodyweight exercises. So, you know, be adaptable. You have to be willing to alter your exercises and try something new. Okay, and to be fair, because we don't know how long this would last, we are hoping by early next year things will go back to normal, but there's no guarantee. Which means whatever sports, whichever competition, whatever races you may have planned for next year may also be cancelled. We may be still having the same competition next year. Okay, so the ideal thing right now is just to maintain your fitness, maintain your health, right? And prioritize other avenues of health. Exercise, training is only one aspect. You still have other avenues to explore. For example, adequate rest, adequate sleep. Okay, a lot of you guys are now studying from home or working from home. Your sleep schedule is probably all over the place. You may be sleeping at 3 a.m. right now and waking up at like, you know, lunchtime sort of thing. So your sleep is all over the place. You may not even get a proper sleep cycle anymore. Your recovery itself is already affected. By the way, that will also affect your immunity. Okay, you also want to look at your diet. Okay, proper nutrition. Proper diet is also a very important part of your training and also maintaining of your health and fitness. Why not focus onto that instead? And another thing is, and I'm sure Philip will talk about it later, is focus on mental health. Meaning, in times of uncertainty and stress, you don't know when your exam is going to be, you don't know how you're going to be evaluated on your coursework, you don't know if you're going to get fired from your job. You know, there are a lot of uncertainties. That brings up a lot of anxiety, a lot of stress. Some people, extroverts especially, when they can't hang out with their friends, that's very, very stressful for them. So they become very withdrawn. They may actually become clinically depressed. So you want to focus on that instead, because if you are not well up here, you're not going to be well anywhere else. Okay, because ideally at the end of the day, when all this ends, and hopefully it will end soon, because I'm also very, very bored of going to roadblocks every single day. we do want you to return to your activity or your sports with minimal issues, which is, getting injured, not fit enough, or you're having some leftover mental issues, stress, anxiety, poor recovery, poor sleep, you're still sleeping at 8 a.m. until 3 p.m. sort of thing. So we just want you to be healthy until this ties over, and hopefully we do. Next slide. So in conclusion, next slide. This is what I recommend, okay? Until we know more about COVID-19, until we have a proper way of managing, or we have a vaccine available, which I also don't know when it will come out. Social distancing is important. That's the only thing that would really help you for getting the virus. And learn to wear a mask properly. Okay, don't put the mask under your nose, because your nose is like a special needs child that needs to breathe air, because that is where the virus is, right? Keep your hand hygiene up, because sometimes when you don't wear a mask properly, you're going to touch your face, you're going to scratch your nose, you're going to touch your mouth, and you are just going to introduce the virus to yourself. And be adaptable. I know times are stressful right now, but if you adapt with the times, it gets you through it a lot easier. Okay, next slide. Okay, these are my social media handles. I actually have two Instagram pages. One is my professional one, and one is my personal one. They are both open to anyone. I don't really care. I went through a period of wanting to make and develop my own website. So last year was that year. So I closed down one, but I kept my website as this. And if you have any issues, you can email me, but try not to. I'm not very good at replying emails. Yeah. Okay, next one. I think that's about it. But thank you so much for listening, and I hope you guys stay safe. And I'm up for questions if you have any.
Thank you, Dr. Aoyong. Well, I think it's interesting how we have to keep ourselves updated on every
I can't hear you though.
Can you hear me? Can you hear me?
Yes.
Okay, right. Thank you, Dr. Aoyong. So I was just saying on how interesting that we have to keep ourselves updated on all kind of precautions to stay active. It is very positive to see that people still want to practice and go for games and things like that, but I think these tips are very important for it. It feels like only superhuman could play sports right now, so that's the whole idea of it now. But talking about superhuman in the sports, I think our next speaker will speak about it. But now, can we take some questions from the they are coming out with the vaccine in the coming week in the last presidential debate.
Okay, I like that question. It's a very, very good question, because I've been following the news and the presidential election as well. Let me tell you that this is the same president that said putting Clorox would actually help cure COVID. Same president that said that sunlight will kill the virus. Okay, the same president that got the infection but refused to wear a mask. The same president that said that Dr. Fauci is wrong about everything. The same president that said that the CDC is wrong. So what can I say? I mean, he's a very controversial man, I do agree. And if you read the news properly, someone actually died during a COVID testing program. So do you want to be that person? Okay, now, if the vaccine is produced, and knowing what kind of president Trump is, and if he wins the election next one, I really doubt he's going to share the vaccine with the world. Okay? And I really doubt he was provide the recipe for the vaccine to other countries. So I am not too, how do I say? I am not too optimistic about the vaccine within this year. vaccines take time to make. Vaccines take a lot of time to test. They have to be safe. Are you willing to take the vaccine when it's not properly well tested? Would you be the guinea pig? I would rather just wear a mask and stay home and tell boss, you know what, boss, I will just work from home or whatever. I would rather do that. So that is my personal opinion and from what I know. Okay.
Okay. Do we have any more questions so far? No. But Doctor, I'm also wondering, what will be a very general question? What will be the best and the simple exercise that we can do during the COVID?
It really depends on what sports you want you are inclined to, because they will also say what kind of body weight exercises to do. But if just for general cardiovascular fitness, to be fair, skipping rope is very, very, very good.
Okay. All right. Okay, I think, is there any more questions? I don't see any questions there. So with that, thank you, Dr. Ouyang.
I think there's one question Mock CC wants to ask.
Oh, okay. I can't see the question. Is there?
Yeah, but he hasn't asked yet.
Okay. Swimming can spread COVID-19. That's the question.
Okay. I have a lot of issues with the swim team. Okay, now, all right, we remember the virus survives in respiratory droplets. Okay, respiratory droplets are actually water droplets. They're just very, very, very small. Now, remember Trump said Clorox can kill the virus? We don't know whether chlorine kills the virus or not. Okay, now, if you are infected, you get into the pool, you spit out some water that went into your mouth, there would be virus coming out together with your spit, right? Okay, that makes sense, right? Now, if someone swims past you quite closely and they took a big gulp of water, so what happens then? That virus in the water itself gets transmitted to the next person. Okay, so it goes back to what we know and what we do not know about the virus. We do not know enough to say swimming is safe. Okay. However, if you have the whole pool to yourself or you're at the sea, it should be fine. Okay, but realistically, people share the pools. And now you guys have CMCO, so you can't even go to the beach. So, that is my answer to that question.
Okay. Is there any more questions? Okay. Most welcome, Mr. Mock. Is there any other questions for Dr. Ouyang? So I think there's no more questions anymore. Thank you, Dr. Ouyang. Thank you very much for the information.
All right, thank you for me now.
Most welcome. I've also put up a note about this. You could follow. Yes, you could follow IMU Alumni in Instagram or Facebook. Yeah. So the recording of this talk will be also shared on IMU Alumni YouTube. So please do share the information to others as well if they have missed this session. Yeah, the Instagram and Facebook. Okay, now may I please invite Mr. Philip Liu, the Sports Psychology Officer in the National Sports Institute of Malaysia, and he will be addressing on mental health challenges for athletes. Mr. Philip.
Hello everyone. Hello Kak Ali. So do I start my presentation? So greetings everyone and a very good afternoon. Thank you to MASISWA and also to IMU for inviting me to share some insights about the mental health challenges that we face in the sports. I've made some changes to the slides and also the presentation topic. So this is the main presentation that I will present for today, which is Adapt, Coping Together, which comes from the word ACT, the mental health challenges in sports and life. So my name is Philip. I'm currently working as a sports psychology officer with the National Sports Institute of Malaysia. So I technically provide sports psychology support to the national athletes and also the teams, so such as the national football team, the national hockey team, and also currently we are preparing the national sailors for the Olympics 2020, which already been postponed to next year. So the topic for today, and we will start with what actually is psychology, which is always like people talk about psychology is like you can read my mind or how it is, but actually psychology, very simple, is on 3 different elements, which is the first one, mindset, about how do you think. Second is on the emotion, how do you feel? And finally, the third one is how do you, and the third one is on how do you act, your behavior. These are the 3 elements in psychology. So back to the topic for today, what is actually the meaning of the term mental health? Every single one, when I ask this question, every single one of you may have different opinions and different understanding about the word mental health. One of the common terms that usually when we ask the athletes, and this was actually a research that being done by us in the National Sports Institute, we asked the athletes, what do you think or what is the definition of mental health? The moment when they hear that word, it's almost like asking them, are they crazy? Am I insane? That kind of mindset whenever we ask the athletes, how is your mental health? But actually mental health is almost the same like the term health. I'm asking you, how are you feeling today? But you not insinuate that I'm asking you, are you crazy or are you insane? However, whenever we use the term mental health, all of a sudden it becomes like a big issue and becomes like, oh, so you think that I'm crazy, that's why you're asking me. But actually it is not. It is actually quite a neutral term. However, maybe the misunderstanding of the people surrounding the society has already stigmatized that word. And every single time when that word comes out, it's almost been linked to mental illness or mental disorder, or even like crazy or insanity, that kind of mindset. So we go to the definition of mental health, the term. As what we can see, based on the World Health Organization, they define mental health as a state of well-being, which every individual realizes their own potential, can cope with the normal stresses in life, can work productively, and be able to make a contribution to his or her community. That is how simple that definition is. As for the US Department of Health and Human Services, they define it as also a state of successful performance of mental functioning and also about fulfilling relationship. So you can see that there are lots of similarities. It is a state of how the individuals cope with the stresses of life, cope with adversities, work productively, and also making contribution, making successful performance, fulfilling relationship, and also the adapt to change. That is how simple mental health is. So based on the statistics that's been done by the National Health and Mobility Survey in 2019, it seems that more and more people are being affected by mental health challenges or mental health issues. It was based on the facts that say that 2.3% of our total population, which is around 500,000 people, has depression among Malaysian adults. And how about children? 424,000 children were found to have mental health problems in Malaysia. If you ask me, I would say that this number is slightly lower than is expected because there are lots of people that do not report even if they have mental health issues. So it can be a big pandemic soon if it is not being managed well together. So these are several of those papers. More and more research studies has been created to address these issues such as on mental health, especially in sports. So what are the relevant statistics related to mental health challenges in sports? Being done in overseas in 2019, they interviewed 6,000 former and current elite athletes. They identified 26% of the former elite athletes and 34% of the current elite athletes reported symptoms of depression and anxiety. These are, we call it, mental health issues. And how about the FIFPro, the Federation of Football? They identified during the April 2020 lockdown, when football is stopped, when all sports is being stopped, they identified an increase of 13% of male footballers and 22% of female footballers reported symptoms consistent with the diagnosis of depression. Some people might say, why females have a high tendency of getting that kind of symptoms? You need to understand that the wage, the salary between the males and the females is different. So the males besides US, most of it, the males do earn more money than the female in a football club setting. Besides that, how about a study being done in Australia? They identified it based on the athletes, the elite level athletes in Australia. They said 1 in 5 athletes reported very high number of psychological distress that they face. So, besides all the scenarios that we mentioned just now, one of the biggest one that really affected our mental health and our mental well-being, especially in this state, besides the pandemic, is the effect of the pandemic towards the major postponement of events, especially towards the Olympics. And when we received the news of the postponement of the Olympics on the 24th of March, everybody was like, oh my God, I've done all my preparation towards that particular moment, towards that special moment. I practiced for 4 years, I've done so much practice, and all of a sudden, it's not there. It's being postponed. And even if it's being postponed, we never know whether how is the scenario going to be. Will there be an Olympics? Will there be a major tournament? Nobody knows. That's why Michael Phelps came out and says that it is this time that we need to be very, very careful and mindful about the athletes' depression and also their mental well-being. So this is actually a stat that is being done by the Health DG in June the 3rd. It says that there was around 9,338 calls to the hotline of the MOH, with 50% of the callers reported emotional support due to stress. How about the numbers now? This was actually just a few days back. They reported that at the moment is 36,269 calls being made as of October 19. And 50% of the callers require emotional support. So we take 50% of 36,000, we are looking at the number of close to 18,000 people calling the hotline to receive emotional support on the stresses that they face, especially related to the COVID. And this, for me, is a huge number. We are talking about people that call. How about the numbers of people that don't call or don't seek for help? So what are the reasons that they are facing, besides the social factors such as job loss, lack of income, relationship problems, and the fear of being infected by the COVID-19? That is always the common cases and stresses that they face. So how about the issues and stresses during the different phases of MCO in sports? This is actually commonly being seen in our national athletes that we work with. Before the start of the MCO, during the pre-MCO, before 18th of March, it seems that it's always that question about, will it occur? Will the MCO occur? And it's almost the same like the scenario that we are facing now at the CMCO. Will the CMCO continue? Will the CMCO be done? We never know, but there is always been an uncertainty that we face. What about, will the CMCO happen? And how would it affect me and everyone? How will it affect the sports? How will it affect my training? And I'm allowed to train. Will there be a competition venue that you can train? How much my training looks like? All these kind of questions do affect the mind and also involve some challenges in you. During the MCO, which is a period during 18th of March towards the mid of May and also early June, is that what are the things that you can do? When you're staying at home, there's nothing you can do, and at the earlier phase of the MCO, you're not even allowed to leave your home. So what actually can you do? And will I be able to maintain my status, especially for those athletes that already prepared very well for major tournaments and also for the Olympics? Am I able to get true to my performance? Will my performance drop? And finally, how long will it last? I think that has always been the questions that we've seen in the WhatsApp group, like, will there be another MCO? Will the MCO be extended? That kind of mindset. Finally, the post-MCO, which is, for me, post-MCO was during like when the sailing team is allowed to start training for the Road to Tokyo program, when we are being quarantined for a month. That is when we start on sports training. That is when people start to ask questions like, when can everything be back to normal? I think that is always been the main question that everybody is asking. And I think that Dr. Au Yong mentioned that, Huisan mentioned that there's no answer to this question, and we need to be able to adapt, cope with the current situation. And will it be safe? And will the situation happen again? And it seems that it's happening again because we are back to the CMCO all over again, and we have no idea how long it will last all over again. And this is the scenario and the phases that we identified that has always been there among the athletes. So this is actually based on the interview that I did with TV3 a few days back. So they're asking about what are the issues that the athlete face during the PKP or the ongoing PKPP. And the 5 main issues that we identified from the athletes they're working with. Of course, the first one is on the safety and also the well-being of the family. Are they safe? Are they safe? Are the family safe? Besides that, it's on the physical and mental status of them. How about their performance? what is the planning, what is their training program looks like, because there are other countries such as like Canada and even like US and America, US and also England, they already start their sports training. However, we are still being locked in. We haven't go to any tournaments. I think like badminton team, most of them already started in Denmark Open. However, we did not participate. How does it affect us, and how does it affect our training and our program? And finally, will there be a future in sports? For instance, for those athletes that are fighting for a contract, will I be offered a contract for next year? Or will it just be goodbye, that's the end of your career? We never know. And these are the issues that will really affect the mental well-being of an athlete, especially when you're involving in elite level sports. So what are the challenges and impact encountered that we see? First and foremost, no matter how it is, it's always the life aspects that plays a very important part in it. Your family, your financial, your safety and health, your education, and even your relationship. The next element is on sports, which is your current results, the injuries that you face. Some athletes do get injured during the CMCO as well. So how do you face it, and how your rehabs will look like? What is your future in sports? And another one is on the environmental. I think that this plays a very important factor, like the surroundings that you are. Are you in a safe zone? How about those athletes that are staying in the red zone? How do they manage their emotions? How do they manage the SOP? The training venues, some training venues are open, some training venues, especially those indoor training venues, are still closed. How do you do your training? And how do you able to manage your emotions and also your thoughts? And also on a country basis, I noticed that it is quite messy around at this moment, especially in the political side. So it will slowly affect it, because we are part of the government, and everything that happens in this country do affect us in one way or another. Finally, is on the current situation, which is the movement control order, the pandemic, the CMCO, the competition status, especially for those athletes that are going for Olympic qualifiers. Will there be an Olympic qualifier? When will it be? Where will it be? All these are questions that need to be answered. However, at this moment, there is no clear answer to this kind of statements. And finally, is the changes to planning. These are the 4 elements that we see usually will affect the mental well-being or psychological well-being of an athlete. And at times, if it is not being handled well, it will affect your mental health. So next, we will look at acknowledging between clinical mental health disorders. Whenever, as I said, when we talk about mental health, we always like to say about mental disorder, such as depression, clinical depression. These are, if you talk about clinical mental health disorders, are disorders that's already been diagnosed by a professional, such as a psychiatrist or a clinical psychologist. How about those subclinical mental ill health? This is sometimes things that sometimes the athletes will say that I'm feeling sad, I'm feeling frustrated, I'm feeling depressed. They do not link to depression. It is more like a feeling. So it is more like a short-term feeling that will go through, and it will not affect their life too much. However, the top one, which is the clinical mental disorders, you would require medication or even intervention. It is like a sickness that you face. So besides that, we identify that athletes do have, we call it a human condition, which is how you experience the stress as a human when you're in the society. And besides that is the athlete condition, the stress and unpleasant thoughts or the challenges that you face when you are in the sports, such as the nervousness, the anxiety when you face when you are playing in the game. These are the 4 acknowledgement or the different terms that we usually use when we handle the mental health issues of an athlete. Let's go for this quote, for those that can read it. After years and years and years of just shoving every negative bad feeling down to a point where I just didn't want to feel it anymore. It was a long, long, long road, and I never wanted to deal with it. And for me, that sent me down a spiral staircase real quick. And like I said, I found myself in a spot where I didn't want to be alive anymore. I think most of you may have seen it. This is actually a quote by Michael Phelps. The one of the greatest, not one of the greatest, the greatest Olympian of all time, 23 times gold medalist. When he mentioned this, or he spoke up about this in 2017 after the Rio Olympics, it caused like an uproar. Oh my God. So Michael Phelps is human after all. Because every single time when we look at the athletes, it's almost like the athletes are superhumans. They are invisible. They are not prone to any of the anxieties that you face. But actually for me, this is what usually we say. Athletes are humans. Despite they having those superhuman, extraordinary sporting talent, they are actually human, and they will face with all the emotions and all the challenges that a normal individual will face in their early life. For those athletes that are listening, I'm definitely sure that you can feel and you understand this feeling. Because when we talk about athletes, it's almost like people always think that you are superhumans, you are like robots. You don't have emotions, you just go in, you're very clinical, you do your job and everything is fine. But actually it's not. There are lots of challenges and there's lots of situations that you will need to cope and you will need to manage, especially in your life and also in your sports. So moving up, we can see that as Michael Phelps starts to open up and more people will start to open, like Tyson Fury, Kevin Love of the NBA, a female Hong Kong swimmer did mention about how she faced with depression, and also Kelly Holmes. So it is not just about gender, male, female, Americans, Asians, Europeans, wherever it is, everyone can be affected by the mental health issues. How about this? These are mental health issues that are not being handled well or managed well. Some of it, like for instance, Kelly Caitlin's case, is just that she did not speak up and unfortunately she committed suicide last year. And similar like this, Ellie Scooter, a skateboard champion, killed herself after she couldn't recover from the head injury that she faced. And these are very, very sad cases. That's why when we talk with athletes, whenever we talk with the public, we say that speak up if you require assistance. It's okay to speak up, and especially speak up to people that you trust. Because when you speak up and when you seek support, there's always possibilities that we can try to assist you. But if you keep it to yourself, you will be facing with it by your own, and eventually sometimes this kind of feelings and the negativity will really eat up on you, pieces by pieces. So this is actually based on a book chapter. If you can see, this is a very, very good one. You say that, I can't take it anymore. So I'm feeling bad. Yeah, I'm not right, not well. People do not understand that this Andres is not who it is. I'm seeing myself as empty on the inside. I'm feeling that I could not be right. I would not be fully fit again. This book chapter is the first page of Andres Iniesta, the World Cup winner from Barcelona's book. Whenever we talk about Andres Iniesta, we always remember him as the person who scored the winning goal in the 2010 World Cup. Everything is good. He won numerous titles with Barcelona, arguably the finest team in the world. But he has the World Cup, as we mentioned. He has a good family, but he is still prone to mental health issues. And to be honest, according to his book and according to his documentary, he wanted to commit suicide after the 2009 Champions League winning team. When, to be honest, at the peak of his career, at the moment he felt that everything is so empty, everything just gone into disarray. It's almost like he could not find a purpose in his life. And if that can happen to Andres, if that can happen to Michael Phelps, it could happen to any one of us. Next, we look at scenarios, especially in the game of football, such as Michael Carrick, Gary Speed, Wales captain and the Wales manager who committed suicide in 2012. And also, this is a very sad case. Actually, this case, Robert Anker, the German goalkeeper, was the start of where the mental health starts to flow in football. Robert Anker's father is a sports psychologist. However, he was so sad that he could save everyone, but he could not save his son from the mental illness that he faced. I think the tricky part about being a psychologist and also being involved in sports, especially as in the psychology field, is that it's very difficult for you to assist and support the people close to you. You can provide support, but there's always possibilities that you need to refer on. And for Robert Anker's case, he did not seek the support that he requires, and eventually he decided to end his life, which is a quite sad scenario. So these are several examples. Regardless of you are the best goalkeeper in the world, as what Gianluigi Buffon is, you say that you do suffer depression and you do have panic attack. Danny Rose as a defender, Andres as a midfielder, or even a striker like the Celtic striker, Leif Griffith. Regardless of who it is, regardless of how successful you are, regardless of how much salary you earn, how many trophies you won, if you do not manage your emotions well, you do not manage your mental health well, you're always been prone to have mental health issues in your life. So this is also a very sad example of a talented footballer who killed himself after being plagued with injuries. How about the role of social media and mental health? I think at this moment, every one of us do have Instagram, and some of us have more than one Instagram account. I'm not saying anyone, but that is how it is. And you do have like Twitter, Snapchat, whatever social media. So social media is almost like a double-edged sword. It can provide support to you, but however, if it's not being handled well, sometimes you can see scenarios or comments such as this. As you can see that a fan sent this particular message to this female footballer, Kani from Chelsea, to say that he wished that she has cancer and leukemia because she couldn't score the goal that helped to win the team. And these are things that will really, really have a major impact on your mental health and your mental well-being. So be very diligent when you're dealing on social media. It's good to have lots of followers. However, just be very careful about the critiques, the comments, the likes that they say. Be very mindful about how do you deal and manage the social media, especially online. So what are the challenges of opening up on the mental health issues? As I said, more and more people are opening up. However, in the Asian kind of mindset, especially some parts of Malaysia especially, we are still very uncomfortable about saying that I need help, I have problems, I have issues. When you say this, it's almost like telling people that you are in trouble and you are weak. So the perception about people, about your own self towards the situation play a very important role as well. Like if I speak up and I say that I have anxiety, I have depression, how would people view me? Will they look at me and think that I'm useless or I have problems? Or how do I view myself? Am I that useless that I really need other people to support me? How about the trust? Whenever I open up and speak it to someone, like my coaches or my officers, am I comfortable and trust them to be able to keep the confidentiality, or they will tell the press and they'll tell the media? So these are the issues that we notice that usually athletes might face whenever they have that thoughts or the options to willing to open up and seek for support, such as feeling embarrassed to ask for help and also to seek for support. Worries that people may think that you are weak, useless, and also leave you out from the team. Not wanting to be treated any differently. Like some people, they're afraid that if I'm saying that I have mental health issues problem, people might think that it's almost like, oh, you have COVID. Oh, this is contagious. I need to be very careful. I need to isolate you, but actually it's not. Mental health issues is, for me, is a normal feeling or normal negative emotions that I feel, and you can get better with the support of professionals or even the support of people surrounding you. How about worries about people might spread rumors, especially on media, social media. Worries that people might say things. Some people might even be worried that if they say that they have issues and they seek for support, people might view them like the attention seeker. This fella is always finding for excuses only. Yeah, whenever you lose, you always say that's as an example, but actually it's not. Maybe he or she really requires assistance and help in the mental health issues that you're facing. Thinking of people may think it's nonsense or you're just being silly. Or finally, is that sometimes it's a concern that people will make a big deal of it, especially no contract extension. People might say that, oh, actually, you have mental health issues, I will not extend your contract. So this kind of fear and this kind of worries sometimes makes them to be very reluctant to speak up, especially in front of public, that say that actually I need help and I require assistance. So this is from Adam Peaty, the British swimmer. So it says that athletes go through the toughest of highs and lows. I've many of both. I struggle and triumph. I've gone through depression. I want to help others to come out on the other side. And it can be a lonely journey, and there's always someone there for you. And Muddy Fish, it's okay not to be okay. There's always been a good quote to show that we can receive help, support, especially in sports. But showing your weakness actually is your strength. So we mentioned about some of the coping strategies that can be used in sports. Just a reminder to say that actually psychological coping strategies, there are a lot in the market and in the books. These are just several that I have used quite regularly with my athletes and I just share with you. All of you do not need to follow it like this is the Bible. This is not something that I would say that you definitely need to use it. These are just suggestions that these are things that have been done. If you want to use it and if it's suitable for you, use it. But you hear others that you think that is much more suitable and you have the other options, go for it. It's fine. As long as you receive the support and as long as you're comfortable with it, as long as you can feel that the effectiveness of it, go for it. It's fine. So whenever we talk about expectations, we always like to think of it as this. This is your plan, and this is the end of the road. And we hope that when you put in the hard work, you will receive the success. Like you go for MCO, eventually all the cases will drop and we'll be fine. We can go back to normal, we can play sports, we can let the fans come into the stadium. Unfortunately, it doesn't work this way. Reality-wise, when you're putting the hard work, there will be obstacles that you face to achieve the success in your life. On this is actually a graphic that I usually like to share with my athletes. I say that if you want to achieve the targets in your life, sometimes you might need to face the bear at the end of the road. There'll be tornadoes, there'll be lots and obstacles that you will face along the journey of achieving success. So managing your expectation is always very, very important, especially in this period. Like such as the athletes that we work with, we let them know that you need to train. However, if you keep on putting like, I need to go out for competitions, eventually you're putting a lot on stress of yourself, knowing that actually the current scenario, it does not permit you to do that. However, if you are able to manage your expectations well, prepare your mindset to know that what are the things that can be done based on the SOP, it will actually free your mind and calm your senses down, and it will provide you with a better mental well-being along the process as well. Besides that, we're talking about self-talk and also the mindset. As we say, your mind is almost like a magnet. It will absorb everything that you say, everything that you do. It's almost like an angel and a demon at your head every single time. So this is a quote. We usually say that your body hears everything your mind says. This is actually like a trivia. How many thoughts or negative thoughts that you think your brain will generate a day? How many positive thoughts that your brain will generate a day? And how many negative thoughts that your brain will generate a day? This is always like the question to ask whenever I deal with any of the athletes. The answer for positive thoughts, every day you will generate close to 2,000 to 4,000 positive thoughts. That is the number that has been done based on the research. How about negative thoughts? Whenever I say negative thoughts, people say, oh, it's a huge number. Yes, it is. It's a huge number. We are looking at close to 45,000 to 60,000 of negative thoughts per day that you will generate in your mind. So it's 2 to 4,000 against 45 to 60,000. So every single time when you have a thought, the high possibility is that it will be a negative thought. So if you always flood your mind with too much of those negative thoughts and you couldn't substitute it or use it, eventually it will affect you negatively itself. Because as what I said just now, your body hears everything your mind says, and it will react based on what your mind says, based on what your thought is. So it's always very important to focus on the positive aspects of the process, even on this current MCO, CMCO, or even the COVID-19. There are things, positive things that you are able to get from this process. Like some of them can be close to their family, some of them can do the things that they haven't done in a long while, take a break, even doing rehab from injuries. So being able to manage the negativity that occurs during this particular situation and this particular journey, and also being able to overcome the challenges to achieve your targets. And finally there's always been a quote that says that always focus on what you can control, because what you can control at this moment is the things that you can do. As for all those things that's out of your control, it's not asking you to completely forget about it. Just put it aside. Focus on the things that you can control now, and it will provide you with a stronger and better mental well-being. This is actually a term that we call it the power of yet. Whenever we use a very negative term, like what I mentioned just now about the thoughts that we have, I can't do this, I didn't reach my target, I don't know, I don't like this, I'm not good at this, it doesn't work. Whenever you put the word yet, it seems to provide a positive element to a negative statement, like such as, I can't do this yet. So it means that I couldn't do this now, but I will work to do it. I didn't reach my target yet, but I will be able to achieve it in the future. Or I don't know yet. At the moment, I haven't done it, but now I will be able to do it in the future. So it's almost like what we say, yet, a word that lets you know that anything is possible. At this moment, we are still locked up, so I couldn't get out from the CMCO yet, but eventually things might get better and we'll be able to achieve it. The next psychological coping strategies is on mindfulness. This is commonly being used a lot by athletes at this moment. So mindful means that you learn to be present and enjoy the moment. It's almost like taking a deep breath to relax and also calm your mind, and also being aware of your emotions and senses. When at times of uncertainties, at times of chaos, at times we get over-obsessed and overloaded with the negative emotions that you feel and the situations that that happens surrounding you. And it will negatively affect your mental well-being and also your mental health. So it's always good to take time for yourself, take a deep breath, stay calm, and think about what are the things that you can focus on and what are the things that you can do, and be aware of the emotions and senses that you feel. If you are feeling some negative emotions and negative senses, for me, this is very normal. Don't be too alarmed and say that, oh my God, I'm feeling negative. It's fine, it's fine. This is normal human emotions. However, there are tools, like what we mentioned earlier, that actually you can use to be able to manage it. Like some of my athletes, whenever they're stressed out, they feel that their mental well-being is not good, they will try to listen to music, they will play some online games. It's fine. As long as it helps you in achieving a better mental well-being, go for it. It's fine. So mindfulness is things that you can't change in the past. Every single time, the things that happen in the past will affect what you think at the moment. It's almost like, oh my God, I did this mistake. What are the things that already happened? Or even you're focusing on the future, which is the things that you can't control that might happen. What will happen if this happens? Like, for instance, will the Olympics be held in the future? To be honest, these are questions that can't be answered and nobody knows the answer to it. So you're actually getting agitated and getting nervous and getting over anxious anxiety because of things that you can't even control. So we say that we will focus on the win in the sense that it is what's important now. What are the things that at this moment, at this stage, during the CMCO, during your home, what are the things that you can do based on the SOP that's being set by the government? What are the things can do that will help your physical well-being, also your mental well-being in this process? So it's almost like be in the here and be in the now. So next, we move on to speak out and support others. Never underestimate the impact that you can do on other people's life or day. If you are seeing that people are struggling, if you know that people are struggling, try to provide them with a platform and a space for them to speak up, like asking them about, are you okay? Are you fine? Is there anything that I can do for you? But it's not asking you to lend them money, lend them lots and lots of money. Money do not solve everything, but that is the scenario that you will face. And asking them this kind of questions sometimes will provide them with opportunities to actually, if they have anything that's in their mind, sometimes they will be able to speak up. And it is always very good to be a role model, especially for those athletes. Be a role model and try to support people through that is in your society and the people surrounding you, because that is where you can gain strength and that is where you can become stronger in the process. Alone, we can do so little. Together, we can achieve so much more. And similar like the quote that is always being used by the MOH, kita support kita, is always very, very good as a sports cohort, even in the education cohort, to support each other, support the frontliners, to be able to provide the support among each other and everyone, to be able to get through this situation and get through these challenges stronger together. These are the 4 R's that we usually promote to the coaches and also to the athletes on the mental health awareness and action. The first R stands on recognizing the symptoms of poor mental health in others. Poor mental health could be some athletes that do not sleep, have sleeping issues, eating disorders, or even they couldn't concentrate. Next is the reach out and support someone in distress, similar like the slide before. Refer to a mental health professional and to recognize when this is necessary. If you think that they require professional help, can seek support, ask them to seek the support of the mental health professionals, such as a counselor, a psychologist, or even a psychiatrist. For those athletes that are in the national team, as we are linked or we are responsible for them working with the team, every single day, every single week, we will keep in touch with them. And they are used to that process to, if they require assistance, they will come out and seek us. But others who are out from this program, if you require support and you notice that people surrounding you require support, please refer them to a mental health professional, and hopefully they will get the professional support that is required. And finally, is to remain supportive over time and show that you genuinely care for them, especially in this current scenario that we're facing. So, how to take care of your mental health? That has always been the good question. Playing sports and exercising, maintaining physical activity and being able to stay active, especially at home, is always very, very important in maintaining your physical health. But of course, the key question now is, please follow the SOP. Do not get caught for breaking the SOP. Do whatever you can. Focus on the things that you can in your home and what are the things that you can do now. Taking care of your body, the food intake that you do, your recovery, your sleep, especially during the CMCO. I noticed that athletes sometimes play games till the night gone. They don't sleep that well. Make sure that your sleep is good enough. Keep yourself hydrated, drink water, manage your screen time, social media, your phones, your games, having a strong social support circle with your friends, families, teammates, people that you trust. This is actually one thing that we emphasize a lot, especially in the elite level athletes. Every single day, we will keep them in touch, like creating activities that they can do together. So even they are not training together, especially for those athletes that are out from the training venues, you can still get yourself connected together strongly and support each other in the process. Be grateful for what you have. Recognize the good in your day and life. There are lots and lots of negativities and challenges that we face in our life, I understand. But there's always the good and positive aspects that you be able to remember and be able to pick up every single day in your life. Having a flexible mindset, focus on what you can control. Sometimes when your mindset is too rigid and things do not go according to what you want, you will get overstressed and it will really affect your mental well-being. It's almost like, I couldn't achieve this. Oh my God, it's the end of the world. Actually, it's not the end of the world. If you can't do this, go another journey, go another road, find another way to go to your destination. That's how it is. Be flexible. It's good to be structured, but also have some flexibility in your mindset about how do you handle and manage the scenarios that you're facing. Find time and space to distress and relax your mind. This is actually also for me because I'm always receiving lots of negativity from the people surrounding me. So to be able to listen to the music, finding a new hobbies, I noticed that most of my athletes become chef. They become everything. They even become barista during the MCO period, and most of them even become like TikTokers and also YouTubers. So whatever it is, find time and that will provide you with the happiness and joy in this particular process. Set realistic goals and manage your expectation, especially for those athletes that are in the process of qualifying for the Olympics or major tournaments. At this moment, you know the scenario. Most competitions are put on hold, so you're unsure where the competition is. Make sure that your goals are being realistic, and make sure there's flexibility in your goals as well to achieve the targets that you set. And finally, is to seek support and assistance when you need it. Getting help is a sign of strength, not weaknesses. So getting the support that you do and also helping other people to get support is a very, very important process throughout this journey. So next is on where can athletes get professional support. These are for national athletes. So these are the common things that we usually will see, like from ISN, the sports psychology officers. From MSN, there is the MAIS, which is the athletes, Malaysian Athlete Career Education System. OCM have the Athletes Commission, their CAPE for retired athletes, the counselors in the respective IPTA, IPTS, the clinical psychologists and psychiatrists, especially for referred cases in the MOH or any of the private practices. Ministry of Health, they have a hotline, and also from some NGOs such as Befrienders. If you require support and you want it to be anonymous, there are some other links, especially at the NGOs, that you're able to seek support and get some available resources to manage the situation. So this is actually a mental and health well-being guideline that's provided by Football in League Managers Association. It's provided to all the coaches and all the athletes. So you can see that it's dealing with change, depression, anxiety. These are valuable resources for those that are interested to read more about the mental health in sports, especially in this is sports football. This, on the other hand, is provided by the US NCAA. It's also related to your mind, body, and sports, and also to understand and support, especially student athletes, with the creating the mental wellness. This is actually two of the infographics that we provided to the athletes. We created to the athletes on how to manage their mindset and thoughts during the challenging moments and situations, especially during the MCO, like such as I'll be sick, situation will be worse, I'm stuck at home, I'm getting weaker, I have nothing to do. These are the negative thoughts that you have. So there are always possibilities that you can restructure the thoughts. I say that I'll be sick. Actually, if I maintain my social distancing, I wash my hands regularly and take care of the personal hygiene, there's always possibilities of reducing and preventing this situation. I'm stuck at home. Actually, by staying at home, you're actually safe at home. And it's always very, very good. Next is on getting through the COVID-19 and also maintaining the mental and physical well-being during this particular pandemic and the MCO. During this time, especially when you spend with yourself, it is a good time for you to take care of yourself in this process, rest, sleep, and also have optimal recovery, be able to smile, be able to be thankful, be able to stay positive, in the sense that being thankful, in the sense that you're thankful for you're safe and you're being healthy, feeling calm, relax, and breathe, stay active, be connected with friends, and also giving you the opportunity to actually recharge mentally and physically. This is a quote. We cannot force someone to hear a message they are not ready to receive, but we must never underestimate the power of planting a seed. Mental health issues has always been there for a long, long time. However, as more and more people, especially those professional athletes, start to speak up, this particular topic has already gained a lot of attention. Now we can see that more and more people are very comfortable to say that actually I have mental health issues and I require assistance. And this is a good start to create that awareness and to create a platform to provide support for the people. So always remember that you need to love yourself, take care of your mental health, because it's almost like you're trying to water a plant. Remember that your mental well-being is equally as important as your physical well-being and requires constant nurturing in maintaining the healthy psychological status. It's almost the same like wherever training that you do. It doesn't happen over time. It takes a long, long process to keep taking care of your own mental well-being and to provide with all the positive elements to be able to achieve that optimal level. So this is a common quote that we use. It's called RISE. This is the last second slide of my presentation. It's good to create a routine, establish daily routine, especially for those that are staying at home. Goals in achieving the physical and psychological well-being, what activities that you can do at home, what are the tasks that you can do, and based on the SOP of the CMCO. Improve. There's always time and ample time for you and space to identify the key aspects that you want to improve on. Are there specific skills that you will improve on? Maybe this is the time for you to improve on your education, it's okay, or your sports skills, whatever it is, and also a positive mindset throughout this particular scenario. Spiritual. More and more athletes are getting into that mindfulness and also the spiritual movement in the sense that it's a good time for you to strengthen the spirit with a sense of connection and meaning in life through expressing gratitude and compassion. And finally, E stands for enjoy. Actually, this is still a good time, despite the challenges and scenarios that we face. It's actually a good opportunity to appreciate the activities that you can enjoy and also love to do, such as spending time with the family, learning a new knowledge. Some of them even learn a new language, learn a new skill. It's a good opportunity for you to do. As what we say, you can rise above any situation and achieve your dreams. This is how it is. We fall, we break, we fail, and then we rise, we heal, and we overcome. So that's my presentation for today. Thank you very much once again to MASISWA and also IMU for inviting me to provide some ideas about mental health in sports. I'm definitely sure that I covered a lot, but there's still lots of things that haven't been covered and haven't been said. So at the end, thank you all for listening. Hopefully you will get something for it, and take care, stay safe, stay active, stay strong, and finally, please stay at home. Thank you.
Thank you, Mr. Philip. We hope that the participant will understand that the strong one will know that they need help, the stronger one will know that they need to ask for help, and the strongest of all will ask for the help. So you don't have to go through this alone. Mr. Philip has showed some of the professional support opportunities. So do approach them, and you don't need to suffer alone. When we understand ourselves better than others, then it doesn't matter how other people understand us. So that's important. So let's see if we have some questions for Mr. Philip here. Okay. Okay. One of the questions from Zifri says, from MASISWA, can you share any of your experience managing Malaysian athletes suffered from mental health, Olympian, if any?
Okay, I think do you mean mental health is like normal mental health or clinical mental health? But I'll just answer the question in both. If say normal subclinical mental well-being, as we mentioned, like the normal anxiety and nervousness is always very normal. We will just base it on interventions such as like the psychological coping strategies that I mentioned, some of it. But if for those mental illness or disorders, such as very chronic, like maybe sleep disorders, we will usually refer it to counselors or clinical psychologists that are in the MOH or even in the private practitioner. That's a referral system that we usually do, but we will still keep in touch with it because there are still skill sets that as a sports psychology officer, there are things that I can do, but there are also things that I couldn't do. It's out of my skill set. So it's always very important to be able to have these kind of connections and to be able to refer it to someone, of course, with the approval of the athlete. Because we want them to become better and stronger in the process, and we want as many of the professional people to be able to help them in this to get better. Hopefully I answered that question.
Okay. The next question seems to be a tricky one. It's a situational question. How can I, it seems to be there's a situation here for this particular athlete. How can I, it's from Matthew Ong, how can I overcome the frustration and anger from being kicked out from my state team due to the biasness from the manager, especially for asking for injury letter from me for rehab, but ended up using it to remove me from the team.
that is a very what this scenario sounds very familiar. Okay, but honestly, this is not something that is extraordinary. It happens even in Malaysia. It happens even overseas. We have seen it so many times. First and foremost, understand that psychology is how do you react to a particular situation. Let's say this situation is your manager has biasness and also asking for an injury letter from you for the rehab and kicking out from the team. How do you think about the situation, or how do you perceive about the situation will affect how do you feel, such as the current frustration and anger. No matter how frustration and anger that you are feeling now, for me, I think that it is a valid and reasonable feeling, because if you get kicked out for the team for whatever reasons that you think that is unfair, definitely you will feel frustrated and definitely you will feel angry with the scenario. However, how long do you want that particular frustration and anger to affect you? That is the good question. Because no matter how frustrated and angry you are about the scenario has already happened and will not change. The only one person that will face it and endure it is technically you. So you are angry on a manager that, to be honest, I don't think they even know, and to be honest, they don't even care. So you are getting frustrated and you have that feeling over and over again, and it's almost like you are the one suffering on yourself while nobody else knows what's going on. I'm not saying that this is right. However, think back about what is the main reason that allows, like for instance, if let's say you have the talent and you are not being chosen because of a particular reason, an unfair reason that you mentioned here, then these are things that you can't control. These are things that you can't do. Let's say if the manager changed in the future, maybe you can get back into the team, but as long as this scenario is happening, there's not things that you can do. Simple said, let's take, this is actually my phone now, just take. How long do you hold on to your emotions and the negative emotions that you feel? Let's say I'm holding this phone. If I'm holding it for 1 minute, do you think I'll feel pain in my hand? Maybe not. Maybe it's still acceptable. How about 30 minutes? Then you will start to feel that more and more pressure and more heavy it goes. So a lot of the scenarios that you face, a lot of emotions that you face, especially negative emotions that you face, is not on the situation itself. The weight of this phone never changed. It depends on how long do you hold on to it. That is how crazy psychology is all about. Sometimes you are the only one that couldn't get through to that process and you're feeling that, oh my God, I cannot let it go. But problem is the issues has already gone on, and the longer you hold on to the emotions is actually affecting your mental well-being. Find a space for you, maybe can speak up to someone. Maybe you can clarify with your team managers if you want to. Write down some of the negative emotions that you feel and also find a way to be able to support you. Because for me, the longer it takes for you to recover, sometimes it will really affect your mental well-being very much.
Yeah, correct. Another question from Siva Ranjani. How to keep focused mentally on being active and doing workouts regardless of packed schedule?
That is, for me, the easiest one is to first and foremost identify your schedules in a sense that create a routine. Let's say if a particular moment, like you said, 4 to 5, you want to set a particular time for you to be able to do the workout. I think it's always very important, because one of the most common tools that we usually establish in athletes is to create a routine and a habit. If you create a routine and habit, it's almost like doing a training periodization. You have higher chances of adhere to it and follow through to it. As compared to, I think today I will do this. And usually if you think, you won't do this. This is how I noticed that it happens a lot, not just in elite sports and also in our life. So set a time. It doesn't, if for those athletes or those individuals that haven't done a training program, it's good to just make it a short, maybe 15-minute session. That's it. It doesn't need to go bombastic and say that I'll do a 2-hour session. Yeah? Go small, go simple, and eventually as time progresses, you can add it on. But creating a routine, find a routine, especially and putting into your calendar or your to-do list, is always a very important step that you can do to manage this situation.
Okay. Yeah, I think I should remember that as well. Okay. That's an interesting question here from my colleague Ashraf Zulkifli. Is there a mental health support in Malaysia for retired athletes, especially those who are forced to an early retirement due to injury?
This, honestly, this question, I don't have a clear answer for this, especially for those athletes that are not in the national program. Because from what I know, for those athletes that I take care of, even they are retired, we do provide support to them along this basis. And I know that the likes of like the Athletes Commission of the OCM and also YAKEP of the Malaysian Athletes Committee for the retired athletes, they do be able to assist them through this process. I honestly, to be honest, I'm not really sure about the answer. I'm so sorry, but I know that if you are a part of the elite national team, we do provide support to them. Even if they are facing difficulties through the retirement, they can still contact us, and we will try to provide as much support to them as possible.
All right. I think it's important to approach the authorities, as you mentioned earlier, then we can get some professional support. Okay, let's see if there's any more questions. Maybe one last question if there's any. Let's give it maybe 10 seconds. Yeah. Yeah, I think, okay. I think there's no more questions here. I think, thank you very much, Mr. Philip. Thank you very much for all the thoughts and all the answers that you gave us. Okay, okay, before we close the session, may I please request all the participants to on the camera for a group photo. Just switch it on for a while, and then this will be a good memory for all of us. So on the count of 10, can we all switch on our camera? Okay, just switch on your camera and then you have a click of it. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's see more. Let's have more cameras on.
Oh, it sounds like a bomb going off.
Okay, let's see how many of them switched on the camera. Quick one. Okay, right. Let's give it another few more seconds. Okay, I can see someone. A lot of people are adjusting. I should have told this earlier. Okay, no worries, no worries. Take your time. Okay. I hope my colleague Ashraf has captured this. Yeah, the camera. A lot of questions asking whether they need to switch on the camera. Yeah, it's okay if you don't have camera, but never mind. Ashraf, in the count of 5, we will switch off this camera. Yeah, 5, 4, 3, 2, 1. Okay, thank you very much for that. So, so that almost comes to an end of the whole session. So just to say that nothing in life to be feared is only to be understood. I think that's what the two speakers today told us. Like if we understand the whole concept of what we are going through today, then just stay calm and we can carry on our life the way that we should be. So with that, I would like to thank all the participants, the speakers, MASISWA, IMA2 team, especially my colleague Ashraf, who has been great help in publicity materials and technical matters. And with that, take care of yourself, be safe, be active. And if you would like to have the recording of this whole thing, as mentioned, you just refer to our IMU alumni social media. You will able to find all this in YouTube, Facebook, and also Instagram. So thank you all of you. See you all. Bye-bye.
Bye. Thank you.
Bye. Take care, everyone. Stay strong. Stay safe.
Stay safe.
Bye. We are all frontliner.
Yes, yes.